a primary or secondary bone tumor. Rhabdomyosarcoma from the muscles are cancers made up of cells that normally develop into skeletal muscles of the body. Liposarcoma from fats normally appears as a slowly enlarging, painless, non-isolated submucosal mass in a middle-aged person. Symptoms include palpation, weakness, limitation of motion, weight loss, fatigue, and lassitude. Sudden cardiac death. It is a result from abrupt loss of heart function. The cause of sudden cardiac death might be a result of coronary heart disease. Okay. Cardiac arrest. Okay. Hypertensive heart disease are caused by high blood pressure that increases the workload of the heart. Here is a chart to illustrate the percentage breakdown of deaths from cardiovascular diseases for the use based on the American Heart Association 2008 update. Coronary heart disease is about 82%. Stroke, okay, over that 17%. High blood pressure 6%. Disease of the artery, okay, 14 or 17, and others. The main issue today comes from the Greek that the inner lining of the large and medium artery. This build-up is called a plaque, atherosclerotic plaque. Okay. This is a progression of atherosclerosis in the coronary arteries. Initially, the plaques deposits remain external as to the lumen, okay, to the lung, and then you get there a fat district. This is a normal artery. Then you get a fat district, a little fat, okay. Then progress to the formation of the plaque, then increasing plaque, okay, over here. Formations, obstructive atherosclerosis, then the artery plaques enlarge. And as the plaque enlarges, the result, it ruptures, and the result of the ruptures will be blood clot. And that clot can clot the heart and cause heart attack. Or the clot can travel elsewhere and to cause emboli. Okay. At this point, the patient is in a state of unstable angina. Oxidative damage. Inflammation due to oxidative damage is implicated not only in the initiation and progression of atherosclerosis, but also appears to play a critical role in promoting plaque vulnerability. That means initiation is caused by oxidative damage, progression is caused by oxidative damage, and plaque vulnerability to rupture and to cause thrombosis and plaques is also due to oxidative damage, right? Through its effects on matrix turnover and release of thrombogenic mediators. These thrombogenic mediators are mediators that will cause plaque. Several studies reported in New England Journal of Medicine in 2000 are showing that the blood indicators of inflammation are strong predictive factors for determining who will suffer a heart attack. So, if you determine this, you know that the patient is prone to heart attack. The most sensitive inflammatory marker is high sensitivity C-reactive protein, that's inflammatory marker. Three common denominators of oxidative damage leading to atherosclerosis are polyunsaturated fatty acid, cornol, phenol, soybean, sunflower, okay. Trans fatty acid, margarine, okay. You know margarine, right? The shortest way to go to heaven is margarine. Okay. And the pyramid diet. The pyramid diet is 60% carbohydrate. If you increase your carbohydrate, you decrease consumption of fats and protein. And that will kill the patient. The pyramid diet is the cause of heart attack. That's what you don't know. Because if you are on a high carb diet, that will instigate the release of insulin. Remember, okay? Ultimately, you develop insulin resistance. And when you have already insulin resistance because of the high carb diet, you develop hyperinsulinism because the pancreas will begin producing more and more. If you have hyperinsulinism, the result is more oxidative damage. Okay? And with the high carb diet, with the pyramid diet, the sugar converts into very complex protein. It is what we call AGE. AGEs. Advanced glycosylated carbohydrates, glucose, advanced glycosylated end product. Yun ang ending nun. End. That is normative. Okay, so that's sugar. Okay, the biggest culprit of chronic inflammation. Okay. Here, by Dr. Dwight Lundell, past chief of staff and chief of surgery at Banner Heart Hospital and author of the cure for heart disease. One, quite simply, all quite simply, they are the overload of simple, highly processed carbohydrates, sugar, flour, and all the products made from them. And the excess consumption of omega-6 vegetable oils like soybean, corn, sunflower, that are found in mainly processed foods. Next. Current medical crops. So, how are these conditions managed by usual, in the usual way, the liver medicine? Use of drugs, use of anti-clotting, anti-thrombotic, and anti-platelet aggregating agents. Okay? Use of cholesterol-lowering drugs, use of anti-hypertensive drugs, use of diuretics and digoxins. Now, what about diet? Diet manipulation to lower cholesterol, low-fat and low-cholesterol diet. Use of polyunsaturated fat, use of trans fatty acid like margarine, right? Use high-carbo diet and also, this is the pyramid diet. And next, because the patient never improved, they resort to bypass surgery and angioplasty. So, because there is an increasing incidence of heart condition because of the wrong diet, that's that they have to increase bypass and angioplasty to decrease. Drugs use anti-clotting, anti-thrombotic, anti-platelets like aspirin, warfarin, coumadin. Coma, what's next for coma? Pill, right? And clopidogrel. However, the use of these agents is not without serious side effects. They can lead to fatal brain hemorrhage, silent GI bleeding, which if left uncontrolled is also fatal, heart failure, kidney failure, and liver damage. That is from Heart Journal 2000, Lancet 2004 British Journal. Okay? Statin and fibrates to lower cholesterol. Statins and citric acid derivatives have been found to cause complications chiefly concerning hepatic function. So, tataas po hepatic enzyme yun, SGPT and SGOT, skeletal muscles, and peripheral nerves. The major adverse effect is myopathy. It affects the heart, so the heart weakens and fails. Rhabdomyolysis. You know what is rhabdom? With ensuing acute renal failure. So, renal failure is caused by preceded by rhabdomyolysis. What is rhabdomyolysis? Remember, the job of the LDL is to supply cholesterol to all throughout the body. So, all cells have cholesterol. So, that's the job of LDL. So, as long as the cells contain cholesterol, the cell membrane is intact. If you remove the cholesterol from the cell membrane, the cell membrane will become like this. Plenty of pullas, that's right. And cancer can get in, infection can get in. Okay, that's right. It was in the 1950s when scientists of the period were grappling with the new threat to public health. 5 deaths per year in the United States. Why? Next slide. The American diet in the 1900s was the rich one. So let us look at their food. At least 35 to 40% of calories are from fats, mostly dairy fats and also eggs, will cause the clogging of the blood vessel. Okay? Salad dressing recipes usually call for egg yolks or cream, only occasionally for olive oil. Lard or animal fat are used for frying. Researchers noticed a change in the kinds of fats Americans were eating, but their consumption was declining. Use of vegetable oils, especially oils, had them to the process of hydrogenation, that is margarine, to resemble butter. Looks like fresh butter, tastes like fresh butter. So everything to resemble, that's margarine, right? And they will say, no cholesterol, don't buy that, you will die there, okay? Add them to the process of hydrogenation by adding hydrogen bomb. Hydrogen, right? to resemble butter was increasing dramatically. So butter consumption had dropped from 18 pounds per person per year to just over 10 pounds, almost 50%. Margarine has risen from 2 pounds to about 8 pounds, several 100%. Okay? Vegetable oil consumption had more than tripled from less than 3 pounds per person per year to more than 10 pounds. This is the exact words of Dr. Paul W. White. So, I began my practice as a cardiologist in 1921, and I never saw an MI patient until 1928. For 7 years, wala siyang harap buhay. Wala heart attack. Okay? But in the MI3 base, before 1920, the fats were butter and lard. Walang cooking oil. Alam niyo what is lard? Kung may mga taba ng baka, siyang pamangkol mo. Okay? And I think that we would all benefit from the kind of diet that we had at the time when no one had ever heard the word corn oil. Canola oil. You know what's canola oil? That is rapeseed oil. When they found out that rapeseed oil is killing a lot of animals, they throw it away. So they did the genetic manipulation of rapeseed oil, and they said it is no longer the same as the one, the original rapeseed, and the name they called it Canadian oil. So that's canola. But that's the rapeseed oil genetically modified, because the original is killing a lot of animals. At first, the American Heart Association, Medical Association, opposed the American Heart Association, opposed the commercialization of the lipid hypothesis, and warned the public that the anti-fat, anti-cholesterol fat is not just foolish and futile, but dangerous. Sabi ng American Medical Association. Pero later on, sumama naman sila. Hindi ko alam bakit. Okay. However, the American Heart Association was committed that in 1961, AHA published its first dietary guidelines, the substitution of polyunsaturates for saturated fat. And that is the result of the increasing atherosclerosis because of oxidative stress. Again, in 1966, Jeremiah Stamler, who co-authored the AHA Dietary Guidelines of 1961, wrote, sabi niya, your heart has 9 lives. He introduced his version of the prudent diet, substituting low-fat milk products such as skim milk and low-fat cheeses for cream, butter, and food cheeses, reducing egg consumption and cutting the fat of red meat. The book was sponsored by the makers of Mazola corn oil and Mazola. Sabi ni Sajama, lowering of blood pressure, sabi ni Stephen Buchanan, of blood cholesterol through drugs and the revised prudent diet is counterproductive. The cholesterol-lowering enterprise threatens to turn a large percentage of the healthy population into patients. Di mo very healthy, sinabi mataas ang cholesterol mo, patient, di ka na yan. Bisa ka na. As a substantial cost to the National Health Service in Britain, that causes billions of dollars. The greatest paradox, look at this. This is from the U.S. Census Bureau report in 2001. Okay. Average lifespan of Americans is 77.1 years, while U.S. doctors are dying at younger age, 50 and 68 groups. An average lifespan of 57 years, even of the very condition heart attack that they are trying to treat. I'm not the one saying that. It's from the study. The Bible says, know them by their fruits. And physicians, heal first yourself. You go first. How can you heal somebody if you are already dead? That's right. Current medical approach. Diet manipulation to lower cholesterol. The diet is low fat and low cholesterol. According to the Neurology Journal, dated this year, February 2011, there was little or no relationship between cholesterol levels and risk of ischemic stroke. Okay? Written out, wala, sabi ng mga neurologists. Walang silbi ang low-fat, low-cholesterol diet. Okay? Another journal of clinical investigation says, conversely, liver biopsies showed that when volunteers were fed 3 to 4 grams of cholesterol daily kung ang pagkain mo mataas ang cholesterol, okay, far more than would ever be obtained from foods. The production of cholesterol by the liver was almost completely suppressed. So if your diet contains cholesterol, the liver will not produce cholesterol. So bababa ang cholesterol. Okay. Next slide. No, statistically, this is July 2011, okay? Bago na ito. August, September, October, November. No statistically significant relationship between cardiovascular disease and dietary saturated fat. So, yung pinakatukutan ng saturated fat, hindi pala masama. Okay? April 2009, Archives of Internal Medicine says, there was insufficient evidence of association between intake of saturated fatty acids and coronary heart disease, and pointed to strong evidence for harmful factors such as trans fat, margarine, and foods high in glycemic index, and that is the pyramid diet. Okay. Hiroshima, Nagasaki, lifespan study, okay, 2003, Journal of Epidemiology, 2003 says, beef, chicken, and milk consumption were not associated with stroke, death, while eggs, dairy products, and fish are found to be protective against intracerebral hemorrhage. So, kumain na kayo ng fish with scales, itlog, and so. Baka naman natitinda ko ng itlog. Polyunsaturated fat. Okay. The use of polyunsaturated fats like corn oil, canola, soybean oil, sunflower, etc. instead of American fats was recommended by the American Heart Association and American Medical Association. Polyunsaturated fats are subject to free radical oxidation attack than saturated fat, and consequently more of the inflammatory, immune suppressive. That means it will invoke atherosclerosis. Immune suppression, that means you cannot produce antibody, thrombogenic, clot-causing, mutagenic, it can cause cancer, and carcinogenic peroxidase fat. That is from the WC Journal, 2002. Polyunsaturated fat has been shown to contribute a large number of disease conditions. Ang daming sakit ang dala ng mga polyunsaturated. Okay. Increased cancer and heart disease. That's why now heart disease and cancer are just number 1 already, right? Because of this polyunsaturated fat. Immune system dysfunction, dumadami ang mga AIDS, dumadami ang H1N1, hepatitis and so on, right? Damage to the liver. Polyunsaturated fats will kill the liver cells, and that will be my topic tomorrow. It will kill, wipe out the liver cells. Polyunsaturated fat will damage the liver, reproductive organs, and even the lungs. So you get COPD, COPD, chronic obstructive pulmonary disease. Digestive disorders, depressed learning ability leading to Alzheimer, impaired growth and weight gain. Vegetables oils are more toxic when heated. One study, I'm talking about polyunsaturated, not the coconut oil, okay? One study reported that polyunsaturates turn to varnish in the intestine. What is varnish? Okay. A 1994 study published in The Lancet showed that almost 3/4 of the fat in the artery glands is unsaturated. Ang laman ng atherosclerotic plaque is 3/4 polyunsaturated fat. So it's not the saturated. The artery clogging fats are not animal fats, hindi saturated fats, but vegetable oils. Okay. Dietary polyunsaturated fats and composition of human aortic plaques, Lancet Journal. Atherosclerosis Journal, Thrombosis and Vascular Biology, July 2001. According to studies, the trans fat diet reduced blood vessel function by 30% and lowered HDL good cholesterol. So, counterproductive, right? LDL is good, but it's lower. That's the trans fat. By about 1/5 compared with the saturated fat diet. Women, this from Circulation Journal, April 2007, in the United States, with the highest levels of trans fat in their blood, had 3 times the risk of coronary heart disease as those with the lowest level. The more corn oil canola you have in your blood, your risk of that of having coronary heart disease is increased 3 times. Angioplasty has never been shown to save the lives of patients who are treated for chronic heart blockage. Why? What is the reason? Because the stent that they use creates a foreign body response. And the foreign body response is that a lot of inflammatory mediators will be produced to go to the heart and will block other arteries. The result is that within 1 year, no problem. Bypass surgery and angioplasty. Mortality rate of both coronary artery, bypass surgery and angioplasty vary greatly. But what is clear is that there is no advantage of either surgery or angioplasty over medical treatment. No studies have shown that either of these 2 interventions will prevent heart attacks or premature death in the future. Okay? Both coronary artery bypass surgery and angioplasty will relieve recurring chest pain in subjects with coronary artery disease. In the case of bypass surgery, 10 to 20% do not get effective relief when patients who receive angioplasty have a return of their symptoms in 40 to 50%. However, relief of pain will occur in 75% of patients without any treatment within 3 to 6 months because of the growth of new vessels. That means without treatment, you have new vessels growing to the area, you can improve. But you should know how to do it. Okay? You will inside the therapy. But you are not you will meet the therapy. What is the effect of high carbo, high polyunsaturated and trans fat? They initiate plaque formation. That is what initiates plaque formation. High carbo, high polyunsaturated fatty acids, and high trans fat. All fatty acids elevated HDL cholesterol when substituted for carbohydrates, but the effect diminished with increasing unsaturation of the fatty acids. That means all saturated fatty acids elevated HDL cholesterol, but when substituted for carbohydrates, but the effect diminished with increasing unsaturation of the fatty acids. So all saturated fatty acids. An analysis, this is from USA Today, April 2009. An analysis of 200 studies found no definitive association of meat and dairy consumption with heart health. But there was a strong association with consumption of starchy carbohydrates like white bread and the trans fat in many cookies and French fries. Okay. Carnosine. Where do you get carnosine? Sa mga red meat, carne. Remember carnosine? Carne. Okay. That is a dipeptide composed of alanine and histidine. Okay? That is from Pharmacological Research 2002. Improves myocardial contractility during hypoxia. Stimulating verapamine effect. A calcium channel blocker frequently prescribed for the treatment of heart disease. Opens completely new horizons in the treatment of myocardial insufficiency. That is from Dr. Navarro. Year 2000. Okay. The entire body of research on carnosine reveals its promise as an anti-aging nutrient that works at several levels to protect multiple organ systems. I tell you, what glutathione cannot handle, carnosine can handle. But carnosine comes from meat. Carnosine prevents glycation. Only carnosine can do that. To save diabetic patients, glutathione cannot do that. Okay? Chelates toxic metals, so it's also a chelator, thereby preventing them from catalyzing oxidation and producing ACE, advanced glycosylated end products, especially among diabetic patients. It is a pluripotent antioxidant. Kumbaga, sa stem cell, siya ay embryonic stem cell, pluripotent. Napaka-powerful niya. So what's the role? These are fatty acids coming from saturated fats of beef fat. Sa mga galit ko yan sa mga beef, sa mga dairy. Nandun po yan sa green. Okay? Trans-vaccinic acid. This is a trans fat. But it is a natural trans fat. A natural trans fatty acid from beef. Okay? Saan nyo nakukuha yan? Sa beef belly. So, mamaya kumain na kayo ng beef belly. Okay? Nandun yung mga fat. Nandun yung trans-vaccinic acid. And also in dairy, that means preferably raw certified milk, yung green on, improves dyslipidemia by lowering circulating triglycerides and all cholesterol and attenuates atherosclerotic progression. So, if you don't like cancer, you need a lot of CLA. But if you are in a low-fat, low-cholesterol diet, you are an easy candidate for cancer. Higher levels of trans-palmitoylate in the blood, another trans fatty acid, which is palmitoleic acid is 16 carbon atoms in the blood, indicate better levels of some chemicals associated with gluten, such as certain types of cholesterol, HDL, and very likely less likely to develop diabetes. Okay. Vitamins and minerals that are readily absorbed, folic acid, vitamins B6, B12, K1, and K2, choline, zinc, magnesium, iron, etc., that can lower homocysteine level, okay, boost immune function, muscle building, protein production, digestion and growth, metabolism, and healing of foods. These are benefits from ruminant meats and prevents cardiovascular disease. That is Atherosclerosis Journal 2009, and reduce risk of diabetes type 2. Okay. Benefits from fruits and vegetables. Before you eat anything, you better eat fruits and vegetables. European Heart Journal 2011, researchers found that those who consume 8 or more servings of fruits and vegetables were 22% less likely to die from heart disease than those who consume 3 or 4 fewer servings a day. So what is important is we must all diet. If we don't diet, we eat. If we don't diet, we will. So that we won't diet. How do I prevent and reverse atherosclerosis? Foods recommended: raw or unpasteurized milk and whey, raw wild honey, fertilized eggs from free-range fowls, organ meats, liver, bulado, brain, heart, etc. Dark chocolate. Very important thing, dark chocolate. Okay? Yung chocolate without sugar. Papaya, lemon, whole wheat bread, pasta, and polished rice. Benefit from raw milk and or whey. Conjugated linoleic acid suppresses atherosclerosis. Journal 2002. Antioxidative. Journal 2003. Butyric acid. Where do you get butyric acid from? Butterfat. Okay? Ano yung butter? You know what's butter, right? That's not butterfat. If you are, kung kayo po ay nasa lupa, ang kainin ng butter ay Queensland. Sa lupa. Kung kayo nasa barko, ang core. Okay. Anti-hypertensive. Shocking. It lowers hypertension. That is clinical experience with hypertension 2009. Remember? So, we are now shifting to butterfat. Improves insulin sensitivity. That means it lowers blood sugar and increases energy expenditure. 2009. Lactoferrin. In raw milk and whey is anti-inflammatory, antioxidant also, and beta-lactoglobulin is anti-hypertensive and cholesterol lowering. As treatment, what about honey? As treatment dressing for wounds and burns. Okay, any type of wound will heal with honey, including fungus infection. Okay, sa mga bata, kasi may sugat, wash the wound, apply honey. Within 2 days, it's over. You don't need to apply anything, nor mertylate. Mertylate contains mercury. It has anti-tumor and immune enhancer. Okay? Because anti-inflammatory, okay, cytokine 2003, promotes better blood sugar control. So, wild honey lowers blood sugar of diabetic patients. More effective cough suppressant. Study shows wild honey is better than dextromethorphan to top topic. Benefits from fertilized organic eggs. Choline and betaine in eggs significantly lower levels of chronic inflammatory markers, including homocysteine level and C-reactive protein. That is from the Journal of Clinical Nutrition 2008. Eating eggs daily does not have a significant impact on blood cholesterol of healthy subjects. Nutrition Journal, British 2006. Cysteine in eggs converts into glutathione. Don't you know that the best source of glutathione is egg yolk and whey? That's the number one, because egg and whey is about 100% biological value. When you say 100% biological value, all the proteins in egg and whey will become parts of the body. Okay? Cysteine in egg, because cysteine is the critical component of glutathione, is a powerful antioxidant capable of deactivating hydroxyl peroxide free radical. These are very, very powerful free radicals. Hydroxyl free radical, singlet oxygen free radical, and superoxide free radical. What about liver, heart, bulalo, bone marrow? Okay. Circulation Journal 2009, when bone marrow-derived endothelial progenitor cells were shown to augment the neovascularization of ischemic tissue. So it's very important. To produce new blood vessels in a coronary patient, revascularized new vascular collateral circulation, you need what? Endothelial progenitor cell. You know what endothelial progenitor cell can do? I'll explain. Okay. Alpha-lipoic acid high in heart, liver, improves body composition, glucose tolerance, good for diabetic and energy expenditure. Okay, that is from 2000 Journal of European Clinical Investigation. Niacin in cow's liver has lower cholesterol levels in the body, along with preventing diabetic heart disease and atherosclerosis. Benefits from dark chocolate. Ibahin tayo ng chocolate. Triggers the production of nitric oxide in the blood, thus relaxing and dilating blood vessels, which allows more blood to pass through and thereby lowering blood pressure. That is Journal Hypertension 2003. If you have an impending heart attack, this is what you do. Kumain na kayo ng dark chocolate. Ayun na, then you apply hair dryer in your chest. And of course you can take the medicine, the usual, but with this additional thing, you can survive the heart attack. So, huwag kayong mawala ng baon na honey. Gusto nyo, katulad ko, lagi may baon honey. Okay? Wild honey. At lagi kayo may baon asin. At dagdagan pa ng chocolate. Kaya punong-puno na ako sa. Okay. Highest levels of chocolate consumption were associated with 30% drop in cardiovascular disease and a 29% drop in stroke compared with the lowest level of chocolate consumption. August 29, Science Daily 2011. Natin yung po ito, right? Siguro. Okay. Significantly increased insulin sensitivity. That is good for diabetic patients. Improved endothelial and platelet dysfunction with chocolate. Okay. Journal of Platelets 2003. And free radical deactivator. So that is good. Para siya antioxidant. Okay. Papaya. You know what where to get papaya? In other countries, they call this pau-pau. Okay. Unripe. Okay. Unripe papaya, fermented papaya. Okay. Yung ilaw, yung green papaya. Contains several antioxidants that can exert the following effects. Antimicrobial. You know the effect of papaya, it removes the coating of the wall of the microbes, just like the effect of penicillin. Okay. But it should be unripe, because unripe contains procteolytic enzymes to digest the wall of bacteria, to digest the wall of cancer. That's why if you have cancer, you better eat unripe papaya. Next slide, out of the program. Cancer preventative, Cassinet, year 2010. Anti-hyperlipidemic, it lowers triglyceride, 2006. Anti-hypertension and anti-hyperglycemia. So it lowers blood pressure, it lowers blood sugar. That's from Pinto Journal 2009. Papaya also contains ascorbic acid, lycopene, a well-known carotenoid that has strong antioxidant property. In further research that was completed here, only papaya among fruits tested can regress breast cancer, lung cancer, hindi na isama ni Mrs. kasi it's not about cancer. Additional, it's good for those with lung cancer, breast cancer, colon cancer, prostrating cancer of the prostate, okay, and leukemia. Okay? It does not include it because cancer is not mentioned. Benefits from whole grain bread. Lowers risk of insulin resistance and metabolic syndrome, thus protective against type 2 diabetes and cardiovascular disease. And ano bang bread yan? Whole wheat bread. Okay. Year 2010. Contains phenolic acids, lignans, phytoestrogens, and certain phytochemicals which help lower the risk of cancer, heart disease, and diabetes. Journal Nutrition, May 2011. Okay. High in fiber, which could reduce health risks like diabetes, heart disease, constipation, hemorrhoid, and colon cancers, among others. Journal Clinical Nutrition, 2007. Confirms greater risk reduction in mortality from inflammatory diseases. American Journal of Clinical Nutrition, June 2007. How to prevent atherosclerosis, proper supplementation, lecithin granules, vitamins, brewer's yeast, vitamins and minerals. Lecithin granules. Lecithin is important for the formation of the enzyme LCAT. That is lecithin cholesterol acetyltransferase. This is the key enzyme for the production of cholesterol ester, which is very important for the formation of HDL. So without lecithin, you cannot produce HDL, right? And the HDL will cause reverse cholesterol transport. Not only will it carry only cholesterol, even triglycerides that carried by the lecithin, anti-atherogenic mechanism by which excess cholesterol is removed. Fibrates lower LCAT activity by 20%. Eggs and cat livers are also very rich in lecithin. That is Endocrinology Journal, Diabetes 2009. Choline keeps cell membranes healthy, reduces inflammation, allows the nerves to communicate with the muscles and helps prevent the buildup of homocysteine, a compound associated with heart disease in the blood. Methionine from red meat helps block the buildup of fat deep deposits on the liver and the arteries, and also aids in the production of choline and in detoxification. That's from the American Journal of Clinical Nutrition, 2005. Vitamins and minerals that are used. Vitamin therapy includes B6, folic acid, B12, and other nutrients to slow the development of coronary heart disease. Okay? High potency multivitamin over a 5-year period were found to lower the risk of a heart attack by 41% compared to women who didn't take the supplement. That is from Journal of American Clinical Nutrition, November 2010. Magnesium supplementation could have a major impact on cardiovascular health and help to correct the source of problems such as high blood pressure. Hypertension Journal, 2011. Vitamin C supplements greater than 400 mg daily lowered heart disease risk by 28%. Okay? American College of Cardiology, 2008. Vitamin E and vitamin C are probably the best vitamin antioxidants. They keep cholesterol from being oxidized and can also act as blood fillers. Okay? American Academy of Family Physicians, September 1, 1999. Patients with low count of vitamin C are 2.4 times more likely to have levels of SSCRP, high sensitivity C-reactive protein, a marker for inflammation and heart disease risk. Adequate intake of vitamin C was associated with longer survival in patients with heart failure. That's from the American Heart Association Scientific Session, 2011. Individuals with the highest antioxidant status were 60% less likely to suffer from a stroke. Vitamin C alone was found to lower the risk by 40%. Journal of Nutrition, 2010. There is a twofold increase in the risk for heart disease in individuals who had a low level of vitamin B. That is from the Circulation Journal 2008. The lower the vitamin B level, the higher the risk for heart attack. Okay? Vitamin E protects cells from damaging free radicals, lowers triglycerides, and was shown to inhibit atherogenic lesions from the Journal of Clinical Nutrition 2006. Vitamin E decreases inflammation in diabetic patients and controls and could be an adjunctive therapy in the prevention of atherosclerosis. That is Clinical Biology in 2009. Alpha-lipoic acid present in red meat, liver, and brewer's yeast may be beneficial in the treatment of diabetic, peripheral neuropathy, and cardiovascular autonomic neuropathy. According to George Bernard Shaw, by the way, my clinic is at Shaw Goldberg, George Bernard Shaw. All great truths begin as blasphemy. Bukod, blasphemy ito ginagawa mo, pero totoo ito. This is especially true when you advise patients to eat red meats, eggs, cheese, butter, bone marrow, bulalo, liver, and many other foods that people view as causing cholesterol problems. As I said, cholesterol is good for you. For conclusion, nutrition has a great role in controlling hypertension and preventing or even reversing complications like myocardial infarction, heart attack, cerebrovascular accident, CVA or stroke, leading to paralysis, hypertensive cardiomyopathies, heart failure due to chronically high blood pressure, hypertensive retinopathy, damage to the retina, and hypertensive nephropathy, chronic renal failure. Rapid cellular balancing, which is a compound of membrane-stabilizing antioxidant, chain-breaking antioxidant, enzyme cofactors, and coenzymes coupled with highly nutritious diet high in animal proteins, choline, lecithin, and inositol, bone marrow, brain, liver, and soft fats, and balanced vitamins and mineral supplement that resulted to sometimes what we call miracle in managing patients with heart attack. So that's all, and thank you for listening.